Welcome. This is Sleep Better TV. I'm Scott Drake. New studies seem to come out every day showing the negative effects of sleep apnea have comorbidity with many other problems. One of the most recent ones is actually cancer. My guest is Dr. Don Wilcox with Desert Smiles and the Arizona Center for Dental Sleep Medicine. Don, it's a great pleasure. Thanks for joining us today.
Thank you very much. Nice to be here.
Well, let's begin by talking about what exactly sleep apnea is.
Okay, well, sleep apnea is a medical condition diagnosed by an MD, usually by having a study at a sleep test. And what the word apnea means is just the lack of breathing for more than 10 seconds. And so when you're sleeping at a sleep lab or a home test unit, that is what is being monitored, is how many times is your airway closing or you're not breathing for that length of time. And also, obviously, your blood pressure is monitored, your oxygen level, all those kind of things. So what happens, oftentimes we're not aware that this is happening, and most of the time we're not aware that it's happening, but our sleep is aroused, interrupted. So some people can have apnea levels of this is happening 10 times an hour, 20, even up to 100 times. Myself, when I was diagnosed, I was near 30 times an hour, even though I wasn't aware of it. So 30 times an hour, your airway is closing for more than 10 seconds. And so you can imagine that puts a lot of stress on your heart, which is one of the primary comorbidities of sleep apnea. Hypertension is very often related very closely with sleep apnea. You're 4 times more likely to have a stroke if you suffer from sleep apnea. And of course, survival rates long term are greatly decreased the more severe your apnea is if it's untreated.
And again, can you also explain some of the negative health effects associated with sleep apnea?
Correct. There's a group in Wisconsin, a cohort research group, and they've been studying this for over 20 years now. And so they probably have the most research related to cardiovascular, heart attacks, and decrease in survival rate because of sleep apnea than any group in the country. And oftentimes you'll hear of a famous person on TV, maybe it's a newscaster or entertainer or whatever, and maybe they're 55 years old and the cause of death is, we'll say they died in their sleep of natural causes. Well, it's not natural to die at those ages in your sleep from natural causes. There's something going on. And sleep apnea is basically you're suffocating while you're sleeping because you're not breathing for an extended period of time. If you just sat here in the room and I told you to hold your breath for 20 or 30 seconds, nobody probably could do that unless you're maybe an athlete of some sort of trained swimming license or whatever. But that is, in a sleep apnea, that is common. We see sleep studies where people don't breathe for 40 seconds, 50 seconds, and their oxygen level should be in the 90%, and it may drop down into 60%, even 50-some%. So you can imagine the tremendous stress that's put on the heart to try to provide oxygen to the brain during that sort of period of time. And so that's why you see a lot of heart attacks and that sort of thing happen in the sleep. It's just the diagnosis hasn't reached a point where it's commonly related to sleep apnea yet.
And Dr. Wilcox, this new study shows a link between sleep apnea and actually cancer. What do you know about that?
Well, it's a relatively new finding, so the research is very new, so we don't know a lot in great detail. This is one of the first times that sleep apnea has even been linked to cancer. It's been linked to so many other things that we've discussed with heart and depression, memory loss, weight gain, those kind of things. But any time the body is subjected to oxygen dropping to these levels, obviously it's putting stress not only heart but other tissue areas. And this may allow the cancer to not only propagate but spread easier because the body's defenses are so weakened. Again, people are more prone to be diabetic because of sleep apnea. Weight gain and all those things tend to decrease our ability to fight off diseases.
All right, Doctor, thank you.
Oh, I was glad to be here. I enjoyed it very much.
That is Dr. Don Wilcox with Desert Smiles and the Arizona Center for Dental Sleep Medicine. I'm Scott Drake. This is Sleep Better TV. Thanks for watching.